Axilla. The axilla is the gateway to the upper limb, providing an area of transition between the neck and the arm. Components of axilla. Axilla resembles four-sided pyramid. It has got an apex, base, four walls, anterior, posterior, lateral, and medial. Apex. The apex of the axilla is blunt and it is directed upwards and medially towards the root of the neck, from where the neurovascular structures enters the upper limb. Thus, apex is not the closed part. It is in the form of a triangular interval which is bounded anteriorly by posterior surface of the clavicle. Posteriorly, superior border of the scapula up to the coracoid process, and medially outer margin of the first rib. Since this triangular interval acts as a communication point between the neck and axilla, it is also called as cervico-axillary canal or axillary inlet. Structures seen through inlet. The axillary vessels, the cords of the brachial plexus, long thoracic nerve pass through the apex. The subclavian artery becomes the axillary artery as it crosses the outer margin of the first rib, and the brachial plexus enter the axilla from neck through this gap. Similarly, axillary vein becomes subclavian vein as it passes over outer margin of the first rib, and subclavian lymph trunk enters neck from axilla through this canal. Base. Base is directed downwards. Base is made up of skin, superficial fascia, and the dome-shaped axillary fascia. It is bounded by anterior and posterior axillary fold. Anterior wall. Anterior wall is formed by the lateral part of the pectoralis major muscle and deeper to it. Pectoralis minor enclosed by clavipectoral fascia and subclavius muscle are present. The anterior wall lodges lateral thoracic vessels and anterior group of axillary lymph nodes. The anterior axillary fold is formed by the pectoralis major muscle. Posterior wall. Posterior wall of axilla is formed by subscapularis, distal parts of the teres major and latissimus dorsi muscle from above downwards. Posterior walls is related mainly to the subscapular vessels, subscapular and thoracodorsal nerves, and the posterior group of axillary lymph nodes. The posterior axillary fold is formed by teres major and latissimus dorsi muscles. Medial wall. Medially, the axilla wall is formed by the upper four ribs with intervening intercostal muscles. It is reinforced by the upper four digitations of serratus anterior muscle. Lateral wall. It is the narrowest wall of the axilla as the anterior and posterior walls of the axilla converge at this region. It is formed by the bicipital groove of the humerus. This wall is closely related to the coracobrachialis and short head of the biceps brachii. After knowing the walls of the axilla, we will now proceed to the contents of axilla. Contents of the axilla. Structures which enter or exit the upper limb forms the main content of axilla. Contents of axilla are axillary artery and its branches, axillary vein and its tributaries, infraclavicular part and the brachial plexus and its branches, Axillary lymph nodes, axillary fat and connective tissue. All other contents are embedded in this. Long thoracic nerve, intercostobrachial nerve, the axillary tail of the breast in most females. Axillary artery. The axillary artery is the primary artery of the upper limb. It is the continuation of the subclavian artery at the outer border of the first rib and lowers down in the arm. It continues as the brachial artery at the lower border of the teres major. Axillary artery and the cords of brachial plexus are covered and protected by axillary sheath, which in turn is derived from the prevertebral fascia of the neck. Axillary artery enters the axilla through the apex of axilla. At this region, it is in contact with the medial wall of the axilla, formed by first two digitations of the serratus anterior muscle. As the axillary artery passes downwards, it comes in relation with the lateral wall of the axilla. Divisions of axillary artery. Axillary artery is crossed by pectoralis minor muscle. This pectoralis minor muscle divides the axillary artery into three parts. First part, second part, and third part. The first part of axillary artery is superior and medial to the pectoralis minor muscle. It extends from outer margin of the first rib to the upper margin of the pectoralis minor muscle. Second part of axillary artery is posterior or deep to the pectoralis minor. Third part is inferior and lateral to the pectoralis minor muscle. It extends from lower margin to the pectoralis minor to the lower border of teres major muscle. Branches of axillary artery. 1 from first part, 2 from second part, and 3 from third part. Altogether, the axillary artery gives 6 branches. Single branch form first part, superior thoracic artery, very slender branch. It passes between the pectoralis major and minor and ends by supplying these two muscles, and of course, it gives branches to the thoracic wall. 2 branches form second part. Thoracoacromial artery are also called as acromiothoracic artery. It emerges at the upper border of the pectoralis minor muscle. It is one of the structure which pierces clavipectoral fascia. It divides into 4 terminal branches. Pectoral branch passes between pectoralis major and minor muscles and supplies both. It also gives few branches to the mammary gland. Deltoid branch courses in the deltopectoral groove. Acromial branch passes above the coracoid process of the scapula and joins the scapular anastomosis at the level of acromion process. Clavicular branch supplies sternoclavicular joint and subclavius muscle. Lateral thoracic artery. It runs along the lower margin of the pectoralis minor muscle. The artery is smaller in males. It is quite large in females to supply the breast, where it gives lateral mammary branches. Third part of axillary artery gives rise to 3 branches. Subscapular artery. This is the largest branch of axillary artery. It lies on the lower border of the subscapular muscle, hence the name subscapular artery. It passes downwards and terminates at the inferior angle of the scapula. It gives off a larger circumflex scapular artery. This branch passes through the triangular intermuscular space, winds around the lateral border of the scapula, and gives a branch to the subscapular fossa and another branch to the infraspinous fossa. All these branches are involved in the scapular anastomosis. Anterior circumflex humeral artery. It is a small branch arising at the lower border of subscapularis muscle. It winds around the surgical neck of humerus and anastomosis with its posterior counterpart. It gives an ascending branch to supply the head of the humerus and also the shoulder joint. Posterior circumflex humeral artery. Quite larger when compared to the anterior branch. It arises at the lower border of subscapularis muscle. It winds around the surgical neck of humerus by passing through the quadrangular space where it is accompanied by the axillary nerve. Finally, it ends by anastomosing with anterior circumflex humeral artery. The posterior branch supplies the deltoid muscles of the quadrangular space shoulder joint. The ascending branch of the posterior circumflex humeral artery anastomoses with the ascending branch of the profunda brachii artery, thus establishing anastomosis between axillary artery and brachial artery. Relations of the first part. From superficial to deep. Skin. Superficial fascia with platysma muscle and supraclavicular nerves. Deep fascia. Clavicular head of the pectoralis major. Clavipectoral fascia and structures piercing it, namely cephalic vein, lateral pectoral nerve, and thoracoacromial vessels. Loop of communication between medial and lateral pectoral nerves. Posteriorly, the first part is related to the first intercostal space and first external intercostal muscle. Serratus anterior muscle, its first and second digitations. Nerve to serratus anterior that runs over the muzzle. Medial cord of brachial plexus. Medial pectoral nerve, a branch from medial cord of brachial plexus. Laterally, the first part of the axillary artery is related to lateral and posterior cords of brachial plexus. Medially, there is axillary vein. Relations of the second part. Anteriorly, second part of axillary artery is related to skin, superficial fascia, deep fascia, pectoralis major, pectoralis minor. So when compared to the anterior relation of first part, the major addition here is pectoralis minor and major deletion is clavipectoral fascia. Posterior relations of second part are posterior cord of brachial plexus, subscapularis muscle. Laterally, there is presence of lateral cord of brachial plexus coracobrachialis. Medially, there is medial cord of brachial plexus, medial pectoral nerve and axillary vein. Relations of the third part. Third part of axillary artery is related to the skin, superficial fascia, deep fascia, pectoralis major muscle in the upper part, medial root of the median nerve. Posteriorly, radial nerve is related throughout. Axillary nerve and subscapularis muscle is related to the posterior part of the third part of axillary artery, whereas lower down it is related to the latissimus dorsi and the teres major muscles. Laterally, coracobrachialis muscle, musculocutaneous nerve and lateral root of the median nerve in the upper part. Trunk of the median nerve in the lower part. Medially, axillary vein. Between axillary artery and vein, there is presence of medial cutaneous nerve of arm and ulnar nerve. Further, medial to the axillary vein, there is presence of medial cutaneous nerve of the arm. Axillary vein is present medially throughout the course of the artery. Bearing the first part, cords of brachial plexus are related to corresponding sites, lateral cord laterally, medial cord medially, and posterior cord posteriorly. Axillary vein. Basilic vein unites with the venae comitans of the brachial artery and continues as axillary vein. This occurs a little above the lower border of the teres major, as described in the relations of the axillary artery. Axillary vein accompanies the medial side of all parts of the axillary artery. At the outer border of the first rib, it continues as subclavian vein. It receives the tributaries corresponding to the branches of the axillary artery. A larger tributary which drains into the upper part of axillary vein is the cephalic vein. Axillary sheath which covers the axillary artery and axillary vein. Axillary lymph nodes. The axillary lymph nodes are scattered in the fibrofatty tissue of axilla. The axillary lymph nodes or armpit lymph nodes, 20 to 30 in number, they divided into 5 groups. They drain lymph from the lateral quadrants of the breast, upper limb, and pectoral region. Also get the superficial lymph vessels from the walls of the chest and the abdomen about the level of the navel, and the vessels from the upper limb. The axillary lymph nodes are arranged in 5 groups. Anterior or pectoral group lies along the lower border of the pectoralis minor, along the course of lateral thoracic vessels and drains the lateral quadrants of the breast, also the superficial vessels from the anterolateral abdominal wall above the level of umbilicus. Posterior or subscapular group lies in front of the subscapularis muscle along with the course of subscapular vessels in posterior fold of axilla. These nodes receive lymph from the posterior wall of upper trunk, the shoulder and the neck. Lateral group or humeral are posterior medial to the axillary vein along the upper part of humerus. Receive most of the lymphatic drainage from the upper limb. Central group embedded in the axillary fat receive lymph from the above three groups and drain into apical group. The intercostobrachial nerve is closely related to them. Apical group lies at the apex of the axilla at the lateral border of the first rib. These nodes receive the efferent lymph vessels from all the other axillary nodes. The apical nodes drain into the subclavian lymph trunk. On the left side, this trunk drains into the thoracic duct. On the right side, it drains into the right lymphatic duct. Alternatively, the lymph trunks may drain directly into one of the large veins at the root of the neck.